Sorry for delay in the class. Today we'll start from aphorism number 205. In the last class, we missed last three classes due to some other engagement. Wait a minute. We want to complete this text as soon as possible, so we will taking from aphorism number 204 today. In the last class we have discussed how the nature tried to expel the disease on the outer surface of organism, and how this suppression of that external disease is dangerous for organism. Means this suppression will initiate another process to quell the disease. Either the disease will go to the weaker organ next in line, or it will again resurface, but that resurfacing will be called secondary eruption, and those secondary eruptions are very difficult to cure. Okay, we have at some point of time we have also discussed that every external disease is not that easy to cure, like primary affections of miasms, like psoriasis. Okay, we have discussed that this psoriasis is not the primary eruption. We are not happy with every external disease. Okay, some external diseases are actually the amalgamation of many of the chronic processes running in the organism, or it is a secondary manifestation of any of the developed miasm. Okay, so external diseases, we are not happy with all the external diseases. Still, we are happy in the sense that disease is still on the outer surface, and organism is so strong that it is able to maintain the disease on the least harmful area of the body. Okay, so we will discuss today from 205. The homeopathic physician never treats one of these primary symptoms of chronic miasm, nor yet one of their secondary affections that result from their further development by local remedies. Okay, both the primary affection and secondary affections of external nature have been discussed there. Okay, these external disease may be of primary nature, may be of secondary nature, but this should not be treated with local remedies, that is with the external application. Exceptions being those injuries where we are using vulnerary remedies. Okay, we have discussed in the last class that how a bleeding artery can be stopped to bleed with a ferrum phos 3x powder. I have discussed the experience of mine in our surgical OPD. Okay, so that is an obvious exception to that external and local remedies. Arnica gel are available. Arnica gel, calendula lotion, arnica lotion, these are available in the market. You can use these external application, like in burn I have told you to use Artica urens. Okay, so these medicines always can be used at local measure for the soothing purpose. Okay, but these external eruption should not be, external diseases except what have been mentioned should not be treated with the local remedies. Next, nor yet one of their secondary affection that result from their further development by local remedies, neither by those external agents that act dynamically. Those external agents that act dynamically, what does this mean? Follow the footnote. I cannot therefore advise, for instance, the local extirpation of the so-called cancer of the lip and face. Underline this. We have read this footnote many classes ago while we were discussing chronic miasm. The product of highly developed psora, or the product of highly developed psora with syphilis. Okay, I hope I am audible to every one of you. I hope I am connected to every one of you. I'm using microphone. If you want to ask some question, you can ask in the chat box. Chat box is in front of me. Okay, so this cancer of lip is actually highly developed SORA or in conjugation of syphilis. We have referred this footnote by means of the arsenical remedy of ferric osme, not only because it is excessively painful and often fails, but more for this reason, because if this dynamic remedy, why it is being called dynamic remedy, because there are no material, there are no material in it, okay, should indeed succeed in freeing the affected part of the body from malignant ulcer locally. The basic malady is thereby not diminished in the slightest. The preserving vital force is therefore necessitated to transfer the field of operation of the great internal malady to some more important part, as it does in every case of metacasmatism. Okay, that metastasis, older term for that, and the consequence is blindness, deafness, insanity, suffocative asthma, dropsy, apoplexy. Neither these can be removed by external remedy, nor this can be removed or this should be removed by surgery. Okay, so neither you can apply your medicine like many often you will see physicians suggesting that applying potentized medicine externally, that is also not a option here. Okay, I'm using microphone, so I cannot hear you. If you have any question, you can write in the chat box. Okay, I hope I'm audible to all of you. Chat box is in front of me. So we are dealing with aphorism number 205. No potentized medicine also should be applied to the local affection. Although in the last class we have seen that in the local diseases, it may seem that medicine applied locally is more effective, but that is also not advisable here. Not yet by all those mechanical means surgical, but he cures in cases where the one or other appears only the great miasm on which they depend. He will treat the disease, internal disease, which is running inside. Okay, he will not treat those external manifestation with external remedies, but rather he will give internal. Who will give? A homeopathic physician. Internal medicine. Okay, and his focus of treatment is on internal miasm, which is running its process in the organism, whereupon its primary, also its secondary symptoms disappear spontaneously. Okay, I have told that external eruption may be primary, may be secondary. Okay, like psoriasis, you cannot say this is a primary symptom of psora. No, it is. We have studied that it is amalgamation, it is a miasm, it is marriage of all three miasm. Okay, but as this was not the mode pursued by the old school practitioners who preceded him in the treatment of the case, most often you will get cases where these diseases have actually been treated with the allopathic suppression. Okay, the homeopathic physician generally, alas, finds that primary symptoms have already been destroyed by them by means of external remedies. Okay, that primary symptoms in eruption, chancre, condylomata, those have been suppressed. Those have been suppressed by allopathic physician. It was true to the time of Hahnemann. It was true to the time of us we are living in. Okay, actually you are not getting what is this round eruption, ringworms you are getting. Do you think these are primary affections, primary eruptions? No, these are not primary eruptions. Actually these are deep psychotic tent amalgamated with psoric. So if you are thinking that psora and psychosis have amalgamated together and formed a new miasm, this can be a primary symptom for that new miasm. Okay, but actually this is not there. Don't think that there is some other miasm. We have discussed this topic in detail, that why there cannot be a fourth miasm. Okay, why there cannot be a fifth meism? We have discussed in detail. People are saying there are 4 meism, 5 meism, 6 meism, but we have discussed that there cannot be fourth meism because we are unable to identify the primary symptom of that fourth meism. Okay, if you are, for the comprehension sake, for your understanding, if you are thinking that psychosis and SORA have evolved to a new fourth meism, then that ring eruption may be taken as the primary affection of that, which actually it is not. Okay, this is a symptom of diathesis, tubercular diathesis. These ringworm are very difficult to cure nowadays. What is it? Why it is difficult to cure? Because it is a fungal eruption. If you go through the science of homeopathy from Vitholkas, you will see that he is arguing that overuse of antibiotic have given rise to these fungal eruptions, these fungal diseases. You know that when one species is subsided, other weaker species will be dominant there. Yesterday or day before yesterday, I have seen a case, candidiasis of esophagus. Do you think that the fungal eruption in the esophagus is somewhat of very primary disease? No, it is a fungal eruption of inside the body. You are getting fungal eruption of liver, you are getting fungal eruption of lung. Why these fungus are affecting our body? Because you will, Vitholkas is arguing there in the science of homeopathy, and I support that argument that over and random use of antibiotic have given rise to these kind of fungal infections, fungal diseases. These fungus not supposed to infect human body. Human body are capable enough to deal with them, but these over use of antibiotics have weakened our immunity such and such, so that these fungus are affecting us. So this is not a primary case, cannot be a primary case. These are difficult cases. These are difficult cases to deal with. Okay, so what is happening? Suppression after suppression, suppression after suppression. These are happening. It is becoming more difficult to cure. Go and search any allopathic skin OPD, okay, and ask any experienced doctor that is it easy to treat ringworm, and they will tell no. It will recur again and again. Either it is resistant to our treatment, to our injections, to our lotions, to our antifungal doses. It is either resistant or it is either recurring again and again. You will see an epidemic of ringworm eruptions. What is this? These are not primary, cannot be primary affections of the skin. These are actually secondary developed secondary eruptions, well developed amalgamation of 2 or 3 miasms. Okay, psoriasis, go and ask any experienced dermatologist and they will inform you that no, psoriasis is not a curable disease. They are telling that these are actually recur again and again with treatment or without treatment. It is incurable disease. Okay, which we know from our philosophy of disease, from our understanding of disease, what disease is. Okay, so this portion was important. What we have dealt, the external disease, externalization of chronic internal disease. These portions are important to develop your understanding of disease, how you are seeing the disease. Okay, so these have already been destroyed by them by means of external remedies, and that he has now to do with more with secondary ones. That is the affections resulting from breaking forth and development of these inherent miasms, but especially with chronic disease evolved from internal SORA, the internal treatment of which, as far as single physician can elucidate it by many years of reflection, observation and experience. I have endeavored to point out in my work chronic diseases to which I must refer the reader. Here aphorism number 205 ended. 206 is dealing with the actually importance of past history in chronic diseases. Importance of past history in chronic diseases. Write in the heading, you can write importance of past history in chronic diseases. Now I am reading, listen. Before commencing the treatment of a chronic disease, it is necessary to make the most careful investigation. Okay, underline this. The most careful investigation. What is this? Case taking. Investigation is actually case taking. You will get these case taking a separate portion from 83 to 104, and you will get these case taking in each section where Hahnemann is dealing with the special diseases. Okay, you will get this case taking in mental disease, you will get this case taking in these external diseases, you will get this case taking in intermittent diseases. Okay, and you are getting case taking in these chronic diseases, especially mentioned here in careful investigation. Now footnote is interesting. You will get these kind of patient in your practice, in your daily practice, like this. I am reading the footnote. Listen carefully. In the investigation of this nature, we must not allow ourselves to be deceived by the assertion of the patient or friends who frequently are assigned as the cause of chronic, even of the severest and most inveterate disease, either to a cold caught, a thorough wetting, drinking cold water after being heated many years ago, or a former fright, a pain, a vexation, sometimes even by bewitchment, and etc. These causes, डॉक्टर बाबू नजर लग गया हमको, कोई जादू कर दिया मेरे ऊपर. ओके, और डर गए थे अचानक से, उसके बाद से ये सब शुरू हुआ. हम ठंडा में भीग गए थे, पानी में भीग गए थे, उसके बाद से ये शुरू हुआ. कब पानी में भीगे थे? Years ago I have been wet, and now this has been started. Okay, these causes are much too insignificant to develop a chronic disease in healthy body. To keep it up for years, underline this, to keep it up for years and to aggravate it by year, as this case will chronic diseases from developed sora. Causes of much more important character than these remembered noxious influences must lie at the root of initiation and progression of serious obstinate disease of long standing. The assigned cause, underline this, the assigned cause could only rose into activity the latent chronic miasm. Okay, underline this. That single cause may arouse the latent sora, but that was not going to develop, that was not going to maintain that chronic disease. Okay, that cause have initiated the disease process. Okay, that cause has initiated that disease process, have excited the latent sora, but that cannot maintain that disease, that cannot aggravate that disease, that cannot develop that disease. Disease was inside before. Then what is knowing, importance of knowing those causes? You can still prescribe depending upon those causes. Okay, here now listen carefully here how these causes are important and not important at the same time. Okay, important from the point of view of, these causes are important from the point of view of tracing back the medicine. Okay, like here was the person standing. Okay, the disease was here standing. Okay, now this disease can travel in this direction, this disease can travel in this direction, this disease can travel in this direction. Okay, physician is standing here, physician is standing here seeing the phenomena of disease. Physician is seeing the phenomena of disease. This is A, this is B, this is C. Suppose this A, कोई धक्का दिया, disease को someone have pushed. Okay, someone have pushed like this, so disease is with a force A, disease will go to in the direction of capital A. Someone have forced, some exciting force have forced the disease to capital B, and that force and causation was B, small b. Someone have forced to C, and that force was see, okay, if you are able to trace this journey back to this causation, this will help you sometime. This will help you sometime to prescribe on causation and reaching your minimum. But that doesn't mean that this cause was maintaining this. This was just initiating. This was just initiating point. This has just initiated disease, and in this is helpful again only for the prescription of your medicine. Okay. Like one of case we have seen in NIH IPD, the patient was suffering from nephrotic syndrome, okay, and given history of getting wet, in the while she was in whole sweat. Okay, actually she was in habit of bathing after heavy work. She was in habit of, and our teacher prescribed Rastox on this history. Okay, Rastox 10 mg or in higher potency was prescribed, and that nephrotic syndrome was okay. Okay, blood after few months of treatment, blood report comes to normal. Okay, that symptomatically patient was relieved, and all those happy results we have seen with our own eyes. Patient will give history of fright. From that point of fright, this much disease have been developed. If you can if you can point out that fright in the patient's case history, you can easily prescribe aconite. Okay, those prescription of acute aconite is very much readily available. But if you know how to prescribe aconite in chronic cases, you will be becoming a good prescriber. So if you can trace back the complaints to the single incident of fright, after that this has happened and I am suffering for all day, all these years, and you prescribe aconite in higher potency. Here you have to prescribe in higher potency because the incident you are prescribing on the causation, and the causation has way back in the history of patient's life. So you are going to prescribe aconite in higher potency. Single incident of fright. If there is a recurrent incident of fright, okay, if there is a recurrent history of fright, think of opium. If there is a recurrent history of fright, think of opium. If there is history of prolonged stressful condition in life of the patient, beta bimar ho gaya tha. I have seen patient actually bronze discoloration of the skin, and he has given me history that मेरा बेटा बीमार हो गया था, डॉक्टर उसको किडनी ट्रांसप्लांट बोला था, मेरा बेटा 6 महीने का था, 6 महीने से 6 साल तक हम उसको लेके परेशान हैं, and now I have developed these symptoms. Okay, in this condition, think of adcortex. Stressful. What is the medicine for stressful condition? What are the hormones for stress? These hormones, adrenaline, the hormones secreted from adcortex, adrenal cortex. These are actually stress hormones, and these are going to produce some changes in your body. Stressful condition and under constant stress. Think of thyroidinum. Under constant, patient have given history of constant parental pressure. ऐसे करो, strict parental guidance in the childhood. Think of carcinosin. Okay. Constant harassment, sexual harassment at the workplace. Constant harassment at in teenage of a girl. Think of folliculism. Think of carcinosin. Okay, these kind of stressful conditions, these kind of causations are going to develop only what there is inside. There was disease, and that has been initiated from those conditions, causations, but those causations are not going to maintain. That has initiated. If the patient's organism, vital force was strong enough, it could have come up with that condition, but as it was not strong enough, it is suffering with the disease. It is suffering with the disease. Okay, so this footnote is important from point of view of prescription on the causation. The last line, this assigned causes could only rose into activity the latent chronic miasm. If it was grief, the disease was pushed to another path. If it was anger, the disease was pushed to another path. There is a spectrum of phenomena this single disease can produce. Okay, there are a spectrum of phenomena which this single disease can produce. इधर धक्का दिया तो उधर चला गया, grief ने धक्का दिया तो it is going toward lungs. हाँ, इस anger ने धक्का दिया, suppressed anger pushed it, disease may go to heart. Okay, this insult may put disease to liver. Okay, like that, depending upon the strength of the organism, vitality of the organism, where it is going back. But remember, these causation is not maintaining. These causations is not maintaining those diseases. Disease was there, just it has initiated. That is why we have read that in the healthy years of youth, aphorism number 84, aphorism number 84, footnote, aphorism number, where there is modification of Sora, during the flourishing years of youth. Aphorism number 78, footnote. Okay, during the flourishing years of youth, these causations, these diseases are not going to be recognized in the healthy, during the flourishing years of youth. Not going to be recognized, but as it is deteriorating, these diseases will flare up. Now, so careful investigation, return to careful investigation as to whether the patient had a venereal infection or infection with condylomatous gonorrhea. For them, the treatment must be directed towards this alone. When only the sign of syphilis are present, when only the signs of syphilis or rare condylomatous disease are present. But this disease is very seldom met with alone nowadays. Nowadays, it is also the fact that you cannot make single gonorrheal patient. They are already suppressed or already amalgamated with other miasm. If such infection have previously occurred, this must also be borne in mind in the treatment of those cases in which Sora is present, because in them the later is complicated with the former, as is always the case when the symptoms are not those of pure syphilis. For when the physician thinks he has a case of old venereal disease before him, he has always or almost always to treat syphilitic affection accompanied mostly by complicated with Sora. For the internal itch dysphagia is far the most frequent, most certain fundamental cause of chronic diseases. Underline this. Either united with syphilis or with psychosis. If the later infections have overdly occurred, at times both miasm may be complicated also with psychosis in chronically diseased organism. Underline this. So Hahnemann is giving all the possible aspects, while dealing with the tubercular diathesis. We have discussed that tubercular diathesis is not a new thing. Hahnemann have discussed it before also. Okay, in mental disease, Sora complicated with syphilis. Here also Sora complicated it with syphilis. We have dealt that, given the possible amalgamation, either Sora with syphilis, Sora with psychosis, or both, all the three, Sora, syphilis and psychosis. There may be condition we have discussed, there may be condition of Sora and syphilis where Sora is dominant. It is also tubercular diathesis. There may be condition of Sora and psychosis, Sora and syphilis where syphilis is dominant. This is also tubercular diathesis. There may be condition of Sora and psychosis where Sora is dominant. This is also tubercular diathesis. There may be condition of Sora and psychosis where psychosis is dominant. This is also tubercular diathesis. So all the four traits of tubercular diathesis we have discussed. For the former two traits we have discussed, we will find our medicine in tuberculinum, and for Sora and syphilis, for the later two, amalgamation, kind of amalgamation, we are finding our medicine in Bacillinum. Okay, so tubercular diathesis may have 4 conditions. Sora syphilis, 1 condition. These 1 condition can be divided into 2. Sora dominant with syphilis, syphilis dominant with Sora. Okay. Other condition is Sora and psychosis. This is also a tubercular diathesis. Sora dominant with psychosis, psychosis dominant with Sora. Okay. These are the 4 aspects of tubercular diathesis you are getting in your practice, and there may be a amalgamation of all these 3 miasm, and you can, by your understanding of symptomatology, you can understand that which is dominant here. Okay, all 3 miasm you will get mostly in cases of carcinosin. All 3 miasms are present. Now with the symptomatology, you are going to find out which is dominant here. Whether Sora is dominant, whether psychosis is dominant, whether syphilis is dominant, and according to that you are going to start your treatment. Okay. So all the aspect of amalgamation of all the diseases, all the chronic diseases have been discussed here. Okay. Next, or as it much more frequently the case, Sora is sole fundamental cause of all other chronic maladies, whatever name they may bear, which are moreover so often bungled, increased and disfigured to a monstrous extent by a allopathic unskillfulness. Underline this. There may be a 3rd condition which you are getting in your practice nowadays. Okay, in the modern days you are going to get these masked diseases. Okay, we have discussed these masked diseases. What mask it is having? The mask of hormonal pills, the mask of painkillers, the mask of steroids, the mask of antacids. You are going to get this. Okay, and these are going to be more difficult to cure before you treat. Actually start your treatment with a chronic disease. Getting my point? I hope you are getting my point, that apart from these 3 chronic miasm, in the modern days you are going to get a mask of unskillful allopathic prescription. Okay, whether it is overuse of vitamins, especially vitamin D. Okay, whether it is overuse of antibiotics. Okay, most often in acute diseases you will get patients with diarrhea after antibiotic. It is common phenomena to get a diarrhea after antibiotic. Why you are getting diarrhea after antibiotic? Because it is along with the good bacteria, it is killing the along with the bad bacteria, it is killing the good bacteria, commensal flora of the intestine also. So you are getting diarrhea. So these diarrhea of acute nature will subsided with when you advise your patient to take some lactobacillus, take some dahi, take some yogurt, and there are in your allopathic physicians are nowadays prescribing those external bacteria also. They are calling it probiotics. Okay, and overuse of, you will see the bad effect of once they find one single thing, no, they will make it routine, and now you are finding that overuse of probiotics are also problematic. Okay, why they cannot understand that you cannot cure something with your unskillfulness? Why there is need of giving extra bacteria in the intestine? They are prescribing random prescription of probiotic for diarrhea. Okay, so these antibiotic causing diarrhea, these are acute mass artificial disease. You will get chronic artificial disease due to steroid. Last week I got a patient. I have shared this in group that was a prescription. She was following for 1 year, and there was a injection of Canacot which she was taking every week for 2 years, and now she is developing edema of the whole body. What medicine I should prescribe? I cannot prescribe her for her chronic natural chronic disease. Rather, I have to deal with this masked chronic disease first, artificial chronic disease first, and I have prescribed her this adrenaline, Adcotex, to nullify the effect of steroid. And the patient have reported that she is feeling well, and the edema is gradually subsiding. Okay, but These are the medicines we have discovered nowadays, but during Hahnemann's time, it seems impossible to Hahnemann that it is next to impossible to deal with these artificial diseases. But nowadays, we can, to some extent, we can nullify the effects of these allopathic medicine. Like we have told that for hormonal pills, we have at our disposal thyroidinum, we have at our disposal Aristochia clematis, okay, for bad effect of allopathic OCPs, okay, for the bad effect of allopathic medicines, for the bad effect of Ayurvedic medicines, we have Nux vomica, classical prescription of Nux vomica. For the bad effects of allopathic medicines, we have Hipersulf. I have discussed some rubric from synthesis repertory where you will get a specific bad effect of antibiotics. There they have given Rustox. Bad effect of penicillin. You will get patients of rheumatic heart disease have taken penicillin for years and now suffering from penicillin, artificial disease of penicillin. How to nullify? There is medicine available in the market which is called penicillin itself. Okay, penicillin 200 or 1 ml you can prescribe to nullify those effects of penicillin. Okay, there are medicine bad effect of heart remedies. Lauretius. I think Lauretius is the medicine. Most probably is the medicine for bad effect of heart remedies. Okay, Lauretius. Bad effect of aspirin, people who are taking aspirin for years together. So these bad effects can be subsided with aspirin itself. There is medicine called aspirin. Lauretius, I think, yes, especially in chest affections, cardiac patient, spasmodic, Lauretius. Most probably bad effect of heart remedies or Lycopus. Anyways, if you know, you can tell me that what is the medicine for bad Lycopus or Lauretius. I'm not finding here. Bad effect of heart medicines. So these are the. So we have discussed what kind of chronic cases you are getting in your clinic, plus this unskillful treatment, allopathic treatment can add to that. Now 207, aphorism number 207 is actually history of treatment. That was past history. Now history of treatment, what sort of treatment he has taken. When the above information has been gained, it still remains for the homeopathic physician to ascertain what kind of allopathic treatment and up to date have been adopted for the chronic disease. Okay, this should be asked for. What perturbing medicines have been chiefly and most frequently employed? Also, what mineral baths? Nowadays it is not there in our practice, we will not get, but there are some Ayurvedic treatment centers which are giving these kind of mineral baths nowadays and been used, and what effects these had produced in order to understand in some measure of degeneration of disease from its original state. Underline this. Why this past history, treatment of past history, history of past treatment is necessary. Underline this, in order to understand in some measure the degeneration of the disease from its original state, and where possible to correct in part these pernicious artificial operations, or to enable him to avoid employment of medicine that have already been improperly used. Okay, bad effect of medicine for seizure. You can use Avena sativa in crude doses to nullify those bad effect of anti-seizure medicine. Okay, now, so past treatment is necessary. What sort of allopathic treatment he is taking is necessary and should be included in your case taking. Next, 208 is dealing with the accessory circumstances. The age of the patient, we have discussed this already in the very beginning. The age of the patient, is mode of living, diet, occupation, domestic position, social relation, and so forth must next be taken into consideration in order to ascertain where these things have tended to increase his malady or in how far they may favor or hinder the treatment. In like manner, the state of his disposition mind must be attended to learn whether the present any obstacle to treatment or requires to be directed, encouraged, or modified. Okay, this has been discussed. We have read this. Now 209. Underline last line, whether these present obstacle to treatment or requires to be directed, encouraged, or modified. Underline this. Okay, 209 is dealing with the repeated conversations. Underline this. Repeated conversation. Okay, the patient is not going to open up in the very first conversation. Okay, in the very first conversation, this is usual finding that patient is not going to open up. Why? He will narrate his story. One, he don't know you. You have been referred by some of his friend or some of his relative. Just he came for his present complaint. Okay, and he is not going to open up to you. So you have to endeavor with repeated conversation. After this done, the physician should endeavor in repeated conversation. Underline this. With the patient to trace the picture of his disease as completely as possible according to direction given above, in order to able to elucidate the most striking and peculiar symptom in accordance with the which he selects the first antisoric. Underline this. The first antisoric, underline this, or having the greatest symptomatic resemblance for the commencement of the treatment and so forth. First antisoric for the commencement of the treatment and so forth. Whether you are going to give antisoric, antisyphilitic, and antipsychotic, it depends upon the symptoms you are getting. Okay, and the treatment will start from here onward and will be directed by the symptomatology. Okay, here from here onward to 10 onward to 230 starts the mental disease. Okay, what is mental disease? In the very beginning of one-sided disease, we have discussed that one-sided disease may be of internal nature, may be of external nature. Of internal nature, may be of physical character, may be of mental character. Physical character discussed, external character discussed. Now, internal one-sided disease, mental type is going to be discussed. So these are in chain. Aphorisms of Organon are in chain, and it is if you can find the link between aphorisms, you will find it easy to read and easy to understand Organon of Medicine. From next class onward, we will start 210, that is mental disease. Segment on mental disease. We will try and complete it in 2 or 3 classes. Okay, any questions you are having, you can ask. If you have any question, you can ask me. So I suppose you have, yes, no sir, okay, I suppose thank you for listening for 1 hour and giving me your attention. We will meet in next class. Hope so. Next class will be on time. We will be regular from now. Thank you.